So the term archetype is something that was introduced into psychology by the Swiss psychiatrist Carl Gustav Jung, who was initially a follower of Freud, but then became a renegade and expanded Freud's concept of the human unconscious from the idea that it was an individual unconscious, something that is related to the postnatal history, that it contains things that we have rejected, that we have forgotten, that we have repressed. He extended it to the concept of collective unconscious, that somehow each of us carries the entire history of humanity, and also the cultural history, actually the mythologies, the mythological figures and the domains from mythology, and that we have access to them even if we don't know them intellectually. And then he discovered that within the collective unconscious there are certain governing or organizing principles. That concept is related really to the Platonic idea that there is a normally invisible and not available to any of the human senses realm, which is the realm of what he called ideas or forms, which will be written with capital letters. And these actually, according to him, would form and inform what is happening here, in the same as the way as Plato believed that, you know, what is happening on this level is actually governed by these primordial cosmic patterns. So this is the concept of archetypes.
So that actually then explains archetypal astrology, correct? That if the planets represent forces, then they have an impact on our behavior here on Earth.
Yeah, this then becomes, of course, critical for astrology, where we have to now expand our entire understanding of the universe, where the universe is not a material system that created itself, but has been created by superior intelligence. And the order is such that there is a domain of these primordial patterns of the archetypes, and that determines what is happening on our level. And the dynamics, the interactions of the archetypes would be systematically correlated with the movements of the planets and the angular relationships that they have. So in this kind of understanding, the planets don't do anything, they don't cause anything. We are not talking about gravitational fields or radiation coming from these planets, but they indicate, in a sense, what is happening in the archetypal world and what kind of energies then we can expect on this level. So it's more like what the function of the watch is. It's telling us, you know, what time it is. Something that we cannot experience directly, but there are all kinds of other things that are systematically correlated with this time, and we can use all of them to infer what time it is.
So then a planetary configuration is an indicator of forces that are at work.
Yes, so let's say in an astrological chart, the planets stand for archetypes, which means like a Venus, for beauty and love and warm relationships and art and aesthetics, and so Mars would be related to prowess and sort of masculine power, Yang in the Eastern understanding, even all the way to aggression and so on. Neptune would represent the mystical domain, or also water, ocean, and so on. So those are representatives of principles that can have actually three different forms. Rick Tarnas in his book talks about archetypes as having, on the one hand, the kind of a Homeric aspect, that they could be seen as deities, Aphrodite, Pluto, Mars, and so on, which would be the sort of mythological or Homeric understanding of archetypes. The archetypes also can be seen as philosophical principles, the way Plato saw it, the ideas, the forms, or they can have psychological aspects, which is the way Jung brought it into psychology, psychological principles. So the archetype is a concept from ancient Greek philosophy, and it was introduced into psychology by the Swiss psychiatrist Carl Gustav Jung. He was initially a follower and student and admirer of Freud, but then became a renegade and developed his own psychology. And he brought a significant correction to the Freudian understanding of the psyche. Freud was talking about individual unconscious, which would contain things that we have forgotten, that we have repressed, that we have not been able to accept. It's a kind of a underworld of very negative emotions. Jung added something that he called collective unconscious, that has two domains, a historical domain, where there's a record of the entire human history, and then what he called the archetypal domain, which was a really container of the whole cultural heritage. All the mythological figures and mythological realms described in different cultures. And he discovered that in this collective unconscious there are certain governing principles, certain organizing cosmic principles, and he used the term archetype for them. When Rick Tarnas wrote about it in his book Cosmos and Psyche, he showed that you can see archetypes from three different perspectives. The first one he called Homeric, and you can see the archetypes as deities, Aphrodite, Mars, Pluto, and so on. Then you can also see them from a philosophical perspective. That Plato's idea of what he called ideas or forms with capital letters, and for Plato, those were principles existing or operating from a domain that's not perceptible to the senses, yet they form and inform what is happening on this level. And then the third perspective that Rick Tarnas mentions is the psychological perspective, which is the way it appears in the psychology of Carl Gustav Jung, when they see them as principles operating in the psyche primarily. But his understanding of the psyche is cosmic. He talks about anima mundi, the soul of the universe. The term psyche is not easy to explain in simple terms, because there are very different concepts and understanding of the psyche. Usually it's understood as the human psyche, and in materialistic science that would be the product of the brain, of the neurophysiological processes in the brain, and would involve anything from our perceptions of the world, our emotions, our thoughts. But on the other hand, we have the concepts coming, let's say, from Eastern philosophies that in Western psychiatry emerge in the form of the work of Jung, where the psyche really is cosmic. He talks about anima mundi, and our individual psyche would be actually teased out of this cosmic fabric. In other words, in that sense, it would reach far beyond something that could be found inside of our brain or that would come from our brain. It has to do with the existence of the universe itself, and would be closely related to, let's say, the Hindu concept that the universe is created by absolute consciousness, Brahman, and that we carry somehow a spark of this cosmic energy, which is called Atman. So the Hindus would tell you we are not Nama Rupa, we are not name and shape, we are not body ego. Our true identity is with this divine spark, Atman. And when we experience it, we realize that that energy that we carry is identical with the energy that created the universe. So there would be a concept of cosmic psyche, which would be far beyond the way Western psychology and psychiatry thinks about it.
So then when someone has a when someone has a psychedelic experience, their personal, individual psyche then expands to open to this cosmic psyche? Is that what happening?
Yes, I'd like to mention the very interesting observation that came actually from Aldous Huxley, famous British-American philosopher and writer who experimented with mescaline and also LSD. And he said that initially he thought that somehow these substances activate certain contents, engrams in the brain, and that they emerge into consciousness. And then when he looked into it deeper, he said now he sees the human brain actually as a reducing valve, that there is, the psyche is much, much larger, and that the brain actually limits the access that we have to this cosmic reservoir, which is a very interesting perspective.
And so I know we were talking the other day.
Also, let me see the boundaries between the individual psyche and this larger cosmic psyche would not be absolute. They would be permeable, and in what I call the holotropic states, which is a certain important category of non-ordinary states of consciousness, this boundary melts and we get access to a much larger reservoir of experiences.
So a non-ordinary state of consciousness, in fact, then is just sort of experiencing the world from a greater perspective than what materialistic society has taught us to acknowledge?
Yeah, well, the usual concept in materialistic science is that the universe is out there, is material, and that we somehow manage to perceive it through the senses, the mediation of the brain. But from this larger perspectives, there are other dimensions of existence that are normally not accessible to our senses unless we are in these special expanded states of consciousness that could be not only by psychedelic plants and substances, but they could also be reached by meditation practices, shamanic practices, and so on. And for some people, these deep domains emerge spontaneously. Now, for traditional psychiatry, this would be a mental disease. You see, the idea that these additional kind of experiences that we don't know in everyday life are created by some pathological process interacting with the brain. And what modern consciousness research has shown, that these are what we would call ontologically real. These dimensions really exist, but they're not normally available to our senses. We have to be in a special state of consciousness, and that state is not pathological. In a sense, it's supernormal. What the mystics experience is not a distorted perception of the world, but they get access to these normally invisible but real dimensions of reality. So a mystic would not have the feeling, now my perception of the world is distorted. They would have the feeling, now I am getting enormous amount of information that actually help me understand who am I and what it is all about. It's kind of additional and clarifying information that is coming, not the distortion. Well, the initial excitement when LSD first came from Sandoz pharmaceutical company to universities and research institutes was that this can produce what we called experimental psychosis. Okay, and this was fascinating because we are talking about microscopic amounts. We are talking about millions of a gram. 100 millions of a gram can change profoundly human consciousness for 6 to 8 hours. And so the initial excitement was, first of all, that we have a model here of psychosis. We can give it to quote-unquote normal people. We can do all kinds of tests before, during, and after. And we get an idea of what's happening in the body biologically, biochemically, when the psyche is so profoundly influenced. Now the idea was that if this is the case, then under certain circumstances the human body can produce substance of that kind, and that mental diseases would not be really mental diseases, they would be aberrations of chemistry. The body would produce substances that would change the functioning of the brain. Now, if we could identify this chemical culprit, we could also find ways of counteracting it, find some kind of neutralizing agent, and this would have been like a test tube solution of schizophrenia and other psychosis. This would be like holy grail of psychiatry. So initially there were all kinds of pathological associations with it. We talked about hallucinogens, about delirogens, about psychotomimetic substances, about experimental psychosis, and so on. And the initial research that we did was actually along these lines, looking for some solution for schizophrenia primarily. And then as we were experimenting with it, I found out something fascinating, which convinced me that we were not really doing psychopharmacology, which was incredible, what we call inter-individual variation. We use different people with the same dosage under the same circumstances. Everybody would have a completely different experience. And then if the same person would take it repeatedly, then also each of the sessions would be different. So this is not the way pharmacology works. You have a pretty good idea what response you would get with antibiotics or strychnine or whatever substance we are talking about. Otherwise we would not have pharmacology or psychopharmacology. And so I realized that this we are dealing with a catalyst, you see, and that the content is not produced by the substances, but that it's released from the deep unconscious realms that current psychiatry and psychology does not know about. Because when it comes, they think it's pathological. They don't see it as something that's germane to the human psyche. And then I started seeing it as a telescope or a microscope, something that provides access to areas which are not normally available. Like, the telescope, we can see galaxies that we cannot normally study. With microscope, you discover an enormous, micro world that is here, but we are not aware of it unless we have the proper tool. And so then I took it from the laboratory to the clinical practice, and started seeing it as something that's going to deepen and intensify psychotherapy.
And then didn't you find too in this process that once people had expressed this deep material, that many had no idea was even in there, that they were healed, or in a sense that they were less impacted by whatever motivated their suffering in the first place, that after releasing this material they were somehow more balanced as human beings.
That people were not aware of that? Or what?
Well, no, that you found that in regular psychotherapy analysis, someone just talking from a conscious perspective, there was not nearly the same level of success as when the...
Oh, sure. There's a tremendous acceleration, this tremendous deepening. I mean, I was in psychoanalysis for 7 years, and when in the 4th year I started bringing in my dreams images that were oral, related to the oral period, this was considered to be relatively successful psychoanalysis. Whereas with psychedelics, you can go in larger dosage. You can go to birth and pre-birth in the first session.
And
we've seen people who compared, one session to years of analysis, or they got beyond where they got in years of psychoanalysis.
And I'm just curious, Stan, also in terms of what you noticed something in the sessions. First I want to talk about, yesterday we touched on the courage, or how you learned that even though people thought they might be dying in the course of their in the course of their session, they really weren't, that it was really just their psyche, the information that was coming up from their psyche that they were working through. Can you talk about that?
That they realized that it was coming from...
Well, rather that as you worked with these patients during their psychedelic sessions, first you started with lower doses, correct? And that was more biographical information, and then as the dose increased, you witnessed that it moved.
Yeah, we used initially lower dosages. I mean, at the beginning the common dose was 100, 150, and so on, and maybe up to 200 in the clinical work. So what came initially for most people were sort of geometrical, aesthetic kind of experiences. That was what we know now as sort of psychedelic art and so on, and then the biographical level. But if the sessions were continued, we were getting deeper, and one of my patients called it the onion peeling of the psyche, like going layer after layer, which was very fascinating because you could see how different levels in the psyche are interconnected and how it is connected to symptoms, at which point the symptoms would be modified. But then when we had a certain number of sessions, or we increased the dosage, that suddenly levels of the psyche were manifesting that are not part of psychoanalysis. If these levels would somehow open up during psychoanalysis, a traditional psychoanalyst would think this is the end of psychoanalysis and would send that patient to a psychiatrist, because they would feel that they are opening up the psychotic terrain. Our model does not have reliving of birth. Now, if somebody had difficult birth and it starts coming up, it's going to be wild. I mean, people would be screaming and shaking and choking and so on. So this would be seen as pathology, and your ordinary psychoanalyst couldn't handle it. So they would now be sent to a psychiatrist, which has happened quite a few times, including my analyst had a patient like that.
But in fact, what you observed was that the people were actually experiencing their birth process, and that there was healing involved in that.
Yeah, but when that level comes, a really radical therapy starts happening. Radical changes can happen, way beyond anything you can get by talking about dreams, and slips of the tongue, and analyzing slips of the tongue, and so on.
And how did you observe I guess what I remember is that you had a series of patients that had similar experiences, and then in your own experiences, your own LSD sessions, it became clear to you that people were re-experiencing the birth process. Can you describe how that passed, how that came to be?
Well, I started seeing patterns when I was working these serial sessions with a lot of patients. Some of the patterns were individual. I found out that the contents in the unconscious were not stored in the form of kind of disconnected mosaic, but they were forming certain dynamic constellations where certain issues were appearing on different levels at different times of their biography, and they were creating these dynamic packets that were connected with the same type of emotions or a physical feeling. Let's say they would have a choking constellation like that. There would be situation where of near drowning, where they were 7, then being choked by an older brother at the time repeatedly when they were 4, then whooping cough. But then, the deeper level was the choking at birth. So I started talking about these constellations as coax systems.
Can you describe?
But then when it reached what I call the perinatal level, which is the level of birth, then it started having similar character in many different patients, with some variations, but birth is birth, so you're going to be squeezed, you're going to be choking, you're going to be struggling. So suddenly the pattern started increasingly resemble to each other. And then when it opened to the collective unconscious, then it became very different. People had different types of past life experiences, encountering different archetypes and so on. But there was this level of birth where there's all human experience, and of course there are differences. It could be cesarean birth and normal birth, and different specific things that happen to individual patients, but there is a significant similarity.
Yeah. Could you describe coax? Because that's really important. I find in my LSD sessions that coax experiences are incredibly profound. It's sort of like almost going down a drain. Can you describe what a coax is?
Yeah, it's a constellation of experiences or events from different periods of your postnatal life that share an emotion or physical feelings. So it could be choking coax. There could be coax that has to do with your bad experiences with men. That could be series of relationships and maybe teacher and then father. There could be experiences that have to do with being contained, being confined, some situation. I had, for example, patients who were locked in a closet for punishment, or there were patients, quite a few patients who experienced in infancy swaddling. It was like situation where they, very, very tightly bound the infants, so they experience either complete confinement or complete freedom, and nothing in between. And that could be an overlay over the situation at birth, where something like that is happening. So there could be that kind of a coax, or even a person in prison, and then some kind of containing situation from childhood, and then being stuck in birth. So there's a theme, there's a topic in the coax that penetrates all the different layers, and then there's also a specific connection then to emotional problems. Let's say that confinement would be associated to claustrophobia, let's say. The choking coax could be related to asthma, psychogenic asthma.
And then you also observed, I believe, that beyond the perinatal memories, in fact, can you describe the 4 perinatal matrices?
Yes, so when my patients were regressing through their biographical history and they came to birth, I noticed that the experiences were forming 4 quite distinct experiential patterns. And then in time, I realized, on the basis also of the reports of the patients, that these patterns were related to 4 consecutive stages of birth, characterized by certain specific emotions, specific physical feelings, but they also represented like a selective opening into the next level, which we now call transpersonal. So the first matrix of this kind was related to being in the womb, either womb that was very pleasant, very comfortable, or womb that was toxic, or where the mother was sick, and so on. The second one was a situation when now birth starts, the uterus is contracting, but the cervix is not open, so the experience of this confinement, being in a kind of hopeless, seemingly hopeless situation. And then another matrix would be when the cervix opens and that the contractions continue, but now there is a way out, there is a struggle to get out, to free oneself, and the fourth pattern is actually the actual coming out. So I started talking about them as basic perinatal matrices, or BPM. So at the bottom of the coax systems, then typically was one of those matrices, depending on the nature of the experiences in the coax. There are, very painful coaxes. There are also very positive coaxes. All kinds of very fulfilling, beautiful situations from your life. There's an overlay over experience of the good womb, or good breastfeeding, and so on. And then I found out later that the coax also had even deeper roots, linking them, let's say, to what seemed to be a past life experience, or what seemed to be a specific archetype, or even animal experiences, or phylogenetic experiences, ancestral experiences, and so on. So the coax is like a multi-layer dynamic system, dynamic constellation that has several levels which are biographical, then a link to one of the perinatal matrices according to the nature of the experiences, and then again connection to these transpersonal experiences, where the connection is through the similarity of feelings, of emotions, of physical feelings. And that is extremely important then in relation to archetypal astrology.
Can you explain?
Yeah, because the planets in your chart stand for archetypes. They're related to archetypes, and the angular relationships between them, which would be like opposition, or what's called square, or conjunction, they would characterize the coax system. And the layers of the coax system would be created at the time when some significant transit activates that particular core, which is already contained in your chart.
So then, if someone, through a non-ordinary state of consciousness, is able to sort of go into that coax system and have the deep experience of passing through the perinatal experience of that, and even into the transpersonal, that's considered a full experience of that coax?
Yeah, you see, I went, having had a strict materialistic education, medicine in a Marxist country, I found it easiest to open up the thinking and including birth, because there is a material system there, very, very highly advanced. So it's actually bizarre that current psychiatry does not recognize that there is a trauma, that biological birth is a psychotrauma. But when we got to these transpersonal experiences, you cannot find any kind of material substrate. And so then I discovered with a lot of intellectual struggle the transpersonal domain, the archetypes, the past life experiences. That was more difficult to accept. But then even larger kind of perspective opened up when the whole process was actually governed by archetypal dynamics. So today I believe that if you have a psychedelic session, if you have a spiritual emergency, or powerful experiences in meditation, that it activates the field, archetypal field, that reflects the transits that you have at the time. And then within that realm, you can get some biographical material that has that archetypal flavor, or the corresponding perinatal matrix, or some past life experiences or archetypal experiences. So it's really the realm, the archetypal realm, that determines what kind of experiences would be coming up. Let's say the person would have a session in which there's a lot of no exit kind of situation, and they would have the feeling this is like the world of Franz Kafka. They would suddenly feel this is the way the existentialist saw existence. They really had it down. They really described the way it is. And everybody who sees it differently has just rosy glasses. Then would have some kind of association to movies of Bergman and scenes from Nazi Germany. And then you find out that that person has some hard Saturn-Pluto transit. And if you look at these situations, the common denominator is again Saturn-Pluto. You find it as significant in Jean-Paul Sartre's chart, in Ingmar Bergman's chart, in Kafka's chart, and you find out this was the world transit at the time when the Nazi things were happening, the Second World War. So the archetype is really clue to an understanding of what's happening in your session.
And I think I remember one time asking you, from Joseph Campbell's hero's journey, from that perspective, what are your magical tools? And you mentioned mythology and archetypal astrology. Is that accurate?
Well, I shouldn't say that, but in this work, I found much more help in mythology and archetypal psychology than in my psychiatric or medical examination. That played a role only when I was looking at the condition of the patients in terms of indications, contraindications for psychedelics and for the breathwork. But once I knew that we were working with healthy people, there's not much medicine in it, not much, and psychiatry would be misleading. I mean, it would prevent you actually for correctly understanding of what is happening. So people who work with the breathwork or with psychedelic, they have to unlearn a lot of what they were taught at the university.
That's interesting.
And many people that I worked with, professionals, got to recognize and appreciate the value of shamanic practices. Actually ended up going to Peru or to Brazil, working and realizing that in some instances shamans of the native culture have better understanding of the psyche than you get from Harvard or from Stanford.
Well, I remember when I learned shamanic journey work with Michael Harner 20-something years ago. There were about 150 people in the room, and probably 3/4 of them were psychiatrists, psychologists, and therapists. So they were there to gain a deeper understanding.
Yeah.
And
Well, the work with these non-ordinary states, particularly what I call holotropic, that subgroup that is healing, transformative, evolutionary, that has also what we call heuristic value, the HEUR, the information, revolutionary information that you can get from these experiences and observations. They ask kind of an urgent revision, radical overhaul of our thinking in psychiatry and psychology. This is going to be a major paradigm shift, and it's going to take a while because it really changes most of the basic assumptions in psychiatry. And so bringing traditional kind of training, psychological, psychiatric training, is going to be an obstacle. It's going to make you less effective or ineffective in this kind of work.
And I'm going to just, let's see here for a second. So we've talked about the psyche, but I'd like to, there's this phrase, cartography of the psyche. And a lot of people credit you with creating a whole new cartography of the psyche. So if you could describe what was that, I think you already have to some degree, but the cartography of the psyche when you began as a psychiatrist was just limited to someone's personal experience. Is that correct?
Well, the current model, the cartography, if you want, that's being used in psychiatry and psychology, is limited to postnatal biography. The idea that the psychological history begins after we are born. This follows Freud's dictum. The newborn is a tabula rasa. It's like a tabula rasa. It's like erased tablet, the way they were writing in ancient Rome. You can say washed blackboard. So there's nothing that precedes birth that is of any relevance for psychiatry, including birth itself. There's no recognition that birth is a trauma, major trauma. So somehow, the brain of the newborn is not able to notice that something strange is happening, and there is no record of that, which is absolutely absurd, because there's a general agreement in child psychiatry and obstetrics that what immediately follows is extremely important. Nuances of nursing can make a difference for the rest of the life of the individual. There's even an agreement that bonding, which is exchange of the looks between the mother and the child, can influence the whole relationship between those two individuals. And people who sort of accept this, they think that the hours of a life-threatening, potentially life-threatening experience that preceded, it's not relevant psychologically. I mean, I cannot follow that logic in a group of people who were trained in rigid sort of logical, rational thinking. So that's the present model. So what had to be added is that there is a powerful record of the experiences from all the 4 stages of birth. And it's supported by the fact that there is now a prenatal research showing sensitivity of the fetus already in the womb. And it goes way beyond. You don't need brain, to have memory. The usual argument is the newborn's brain cannot create memory of birth because it's not what's called myelinized. It's not the covering of the neurons by the myelin sheets. Myelin is a fatty substance. It's not completed. It's given as a reason why there could be memory of birth. At the same time, a Nobel Prize was given, I think 15 years ago or so, to Eric Kandel for studying memory mechanisms in a sea slug called aplysia. So sea slugs can have memories, but this complex organ, of the newborn, brain of the newborn, is not able to record anything from hours of a potentially life-threatening situation. So that's one major, very logical expansion that has to happen. You don't even need psychedelics, you just need some straight thinking that's not influenced by the trauma itself. It's so scary that you don't want to go there and think about it, and you come up with some story why that was not relevant. But then it expands, and then you have to add the domain that was so thoroughly explored by Jung and his followers, the collective unconscious, in both its historical and archetypal domain. So this is the cartography we have to make our understanding better. We cannot have adequate understanding of emotional psychosomatic problems unless we use this cartography, and we will not be very effective by treating emotional psychosomatic problems. Because talking cannot reach, you cannot talk out birth, cannot reach those levels. You need experiential method where people can deal with the emotions and they can release the pent-up blocked energy that comes from the situation.
We once talked about a pyromaniac, the kind of experiences that someone might have in the birth process that remain sort of unconscious or in the subconscious, and that an individual might be propelled to certain behavior as a young person or into adulthood as a sort of unconscious desire to recreate that experience, to sort of make peace with it. Can you describe that? Because that was fascinating to me.
Yeah, well, what you see, if you have this kind of understanding, you can see many of the conditions that are considered pathology as a kind of a misguided or I would say as an attempt at healing which is based on inadequate understanding of what is happening. So for example, various sadomasochistic practices where people need to be choked at the same time that they're experiencing sexual arousal. They have to be bound, they have to be confined, and so on. Confined. That is a situation that you would have in people who are reliving what I call the third matrix, the struggle through the birth canal, where the choking and the pain generates a lot of sexual feelings. Now, if these people would have that experience in a psychedelic session or a holotropic session, or even supported spiritual emergency, they would clear somehow this memory, the traumatic memory, and it would move them to the fourth matrix which is coming out. Now, they somehow feel that they need that kind of experience, but they don't know that for it to be really healing and useful, it would have to come from their unconscious, with understanding what you are dealing with, where it is coming from. Just sort of fabricating this kind of a situation in everyday life without this deeper connection will just create a need to repeat it again and again, because you feel that it should bring something that it's not bringing you. And like the arsonist is another example. For many people, the coming out, the transition from the third to the fourth matrix, is associated with experience of fire, passing through fire, being burnt in fire. It could be connected with a past life experience of being burnt at a stake or in a house. And then it's experience at the time of the transition, at the opening. Okay? And so they can be in a psychological state where they feel that somehow experience enormous fire would be fantastic for them. It would bring something fantastic. And so they actually do, and they start the fire, And when they are watching it, they experience some excitement and that the fire is over, but they didn't deliver what they expected. So they would try again because the feeling that they need something like that is very strong.
Yeah.
Now, the extreme form, of course, is where people are somehow at the transition, when what's emerging is now the situation when they were born, but it's not really emerging fully, which would be healing, but it's sort of strong enough to the threshold of consciousness that they feel that they should die. There's an experience of ego death and rebirth. But in our culture, you cannot die in any other way than killing the body, because you're taught that you are your body. Whereas what this is about is the experience, death followed by rebirth. So the work with these people would be somehow sending them a message that it's not this result of pathology. They're sick, they're depressed, and this is why they want to die. And then if we treat them, they're going to not have this death wish anymore. You would say, no, you want to die, we'll help you die, but let's leave the body out of it. All you want is an experience of death, and that's going to be followed by rebirth. So we, would somehow work with them, where actually you activate the unconscious where this matrix is coming, and they will have a very convincing experience of death that's then followed by rebirth. So it's a suicidal tendencies of this kind, so mostly for violent suicide, they are they could be seen as a confusion between suicide and egocide. People want this death of the ego followed by a major expansion of consciousness, as compared to death, which is destruction of your body.